Good morning, Dr. Denise, and Happy New Year to you.
Good morning. Happy New Year to you too.
Good morning. Looking radiant as always.
You're looking really good today.
All right. Okay. I do hope your guest is on standby, Dr. Nwamaka Lasebikan, the Director of Research and Innovation. So you have the floor now.
Thank you. Good morning, viewers. Happy New Year and welcome back. It's quite nice. This is 2025. It's quite nice to be saying the word 2025. For someone like me, that means a lot. So let's start from that perspective. Happy New Year and welcome back to another edition of Kakaki Cancer Awareness with Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation, in partnership with AIT. Together we fight, together we win. Firstly, we'd like to thank all of you who are with us and have been with us since we started this program. I think it's 3 years now. And here we go again. We're starting 2025 on a very positive note. What are we looking at? Empowering patients through innovation. Who have we got here with us? We have got Dr. Nwamaka Lasebikan. I got it right this time?
Yes, you certainly did. Good morning.
Morning, Doc. How are you?
Fine, thank you.
Happy New Year to you.
Same to you. Same to you. Happy New
Year, viewers. So let me start with all the things that we would normally start with. Let's first remember that this month is Cervical Cancer Month. So all of you need to start gearing up towards whatever activities. And to the general public, please look out. This is my appeal to all the awareness programs across Nigeria and try and be part of it. You see, I'm starting on this note because it's important. Make sure you're part of it and you get yourself through any of the screening programs you find, any activities going on in your state, your neighborhood. Just be there. Find out what's going on. And if you learn, if you know, you learn. If you learn, if you know. Whichever way you do it, you've got to learn. Because whatever you know, knowledge is power. So let's go. I'm going to also start with another thing, giveaway. Giveaway is back. January giveaway will be coming up soon, so make sure you are in it. You have to be in it to win it. So if you're not in it, it's for cancer patients. Cancer patients, people who are in active treatment. If you want to be part of the giveaway, just stay on our page and you see when it comes up. It's 50,000 every month. So let's look at it. I want to start by looking at, I started with this cervical cancer thing, and I think it's a good place to start, to open, to make sure that we are aware of what's going on this month. And I want us to just be fully aware that in the next episode, we will be looking into this topic, cervical cancer, in more detail. So, Doc, let me introduce you to our public. I'm sure they are so used to seeing you on their screen, but for those who don't know you, let's go back to the drawing board. Dr. Nwamaka Lasebikan, who I will refer to throughout this interview as Dr. Maka, is a trained clinical radiation oncologist and serves as the Director of Research and Innovation, that's NICRAT, at NICRAT, and is also the National President of the Association for Radiation and Clinical Oncology of Nigeria, that is ARCON. He's also the treasurer of the African Organization for Research and Training in Cancer, IOTIC. Wow. And she's a member of the CCAN's Gender Global Group. Those are those that advocate for gender-responsive cancer care globally. I like that one. She is a global cancer advocate and is passionate about empowering underserved communities and healthcare systems to achieve better cancer outcomes through strategic research, capacity building, policy advocacy. Good morning, everyone. Here we have a very high-profile person sitting with me to talk about cancer. Together we fight, together we win. Sit back, relax, let's have fun, and let's listen to what's going on. Thank you all for joining us. Let's all remain united against cancer. First question, Doc. Straight to the point. I'm going from this perspective. What are the key challenges faced by cancer patients in Nigeria in accessible, timely, and affordable care? Let's go straight to the point. Let's be sharp.
Okay, thank you very much for having me here, Denise, and it's a pleasure to be here once again. And cutting to the chase, what are the problems with cancer care in Nigeria? Honestly, I have to tell you that the problems are huge, multifactorial, multifaceted, and there are problems along every path of the cancer continuum. That's the patient's journey from even before they discover they have cancer all the way to when they discover it and attempt to seek treatment. We know that many of our patients come in really late stages, and which we really hope to change, because ultimately the outcome of treatments that one gets will depend largely on early diagnosis, early detection when the patient presents early, and being able to access treatment and taking the treatment as prescribed all the way to the end. So the challenges facing cancer patients in Nigeria, like I said, multifactorial. There's a lot of misinformation with cancer in Nigeria, lots of stigma, poor awareness. People don't really understand the early symptoms of cancer. They really don't know when to actually get up and go to seek medical help. Again, one might argue that there are many reasons. Yes, there's lack of awareness, but then there's also the cost issues, which brings me to the other thing. Then really, once you discover that, once there's a discovery that something is really not right and there's an attempt to seek care, there are challenges with disparities of care, access, both infrastructural access and also, being able to get the right physician to be able to attend to them. So, for instance, case in point, like when we talk about the disparities with infrastructure, radiotherapy is a core component of treatment for cancer in Nigeria. And globally, it's stated that what is really acceptable is like having about 4 units of the linear accelerator to a population of about 1 million people. We have a population as of around 250 million thereabouts in Nigeria. So if we were to follow those kind of global best standards, we should have about 1,000 linear accelerators in the country. But sadly, we have only 15. So that puts pressure on where people can go. A patient somewhere in Northeast may have to travel about 4 hours to be able to access the life-saving radiotherapy. So that in itself, it's a burden. Then treatments all over the world, treatment of cancer is expensive. There's limited coverage on any health insurance scheme, really, whether the national or, so patients have to pay out of pocket. And we see that impoverishing a lot of homes, a lot of families. So that, again, is a problem. Then understanding what the treatments are, the treatment modalities are, is also an issue. Problems with even post-treatment like yourself, and which is why we really am happy with the way you are promoting and advocating for insights into the post-treatment care, which is survivorship, or even during treatment, the things that need to be done to be able to help the patients progress through the cancer journey. So just a brief overview, just high level, these are the many touch points that Nigerian patients have problems with when they attempt to access cancer treatment.
Yeah, thank you. That's a very nice way to let's start this conversation, because when we're thinking about cancer care and we're thinking about where we're going, if we don't look at where we are and recognize what is wrong, how do we want to start to fix it? And one thing that always comes back to the drawing board is, and I will say this because it just keeps coming up, why is it that we're not campaigning? I'm just throwing a thought. Why are we not campaigning to stop self-medication? That is a key thing that the Federal Ministry of Health has to take on board. Because I believe that if we stop that, you guys have a better chance of getting to early diagnosis. That's my own just thought. Hello, how are you? Let's keep going. No, I'm just throwing it out there because honestly, even it's not about Nigeria. let's talk about Nigerians as a whole, and we're still the highest presenters globally. So if we're still remaining as the highest presenters globally, what is our common thread? Let's keep going.
I think just to say something to that, self-medication, yes, but I think at the bedrock of it is that awareness gap that I mentioned at the beginning. So if more people are aware of the signs, the symptoms, more people are aware that there's help at the end of the tunnel, more people are aware that people actually seek this help, go through the treatment and survive, then I think all of these things will motivate people to actually go out once there's something wrong without necessarily having that diagnosis to go out and seek help. So it really starts with awareness creation, being able to educate people at all levels, whether it's in the urban cities or the rural population, just empowering even the healthcare workers at the primary health centers with the basics in terms of if you are bleeding and you're postmenopausal, it is not your period trying to come back, you really need to scale this up. Come and see me. Or if there is a lump or you feel your breast is changing color or it's, they can tell because people go there. Again, empowering, maybe to your point, maybe also going a step further to empower the chemists and the pharmacists because our people also will go there first, but really get a lot of people really educated so that they can pass this knowledge down. And then hopefully once they are empowered with knowledge, they might not be able to do, willing to toe the line of self-medication.
Awesome. Let's start now. 2024, 2025, that's a very good assignment to the general public. Please, let's follow the rules. Let's follow these discussions because they're not just for talking. Next one, what innovative strategies? Now, I'm going to innovation because we're in the 21st century. The time is going very fast. What innovative strategies or technologies? Now, I use the word technologies in the cancer space. So I'm being specific, right? Have the potential to improve cancer diagnosis and treatments in Nigeria. What are the new innovations? What's happening?
I think, let me go back to the last question which you just asked. I think looking for innovative ways to provide information across board to the general public is definitely one way to reduce late presentation.
What are they? Give us some ideas now, please, Doc.
One of the ways is partnering more with TV, media, social media, engaging some of these things to be able to get that information out there. Really, we're looking at that, and I'm sure this will come up later on, so I really don't want to preempt myself, but we are at this point looking at how to partner with media houses and other organizations to get that word out there. But we are mindful in putting out that information in a culturally acceptable and culturally sensitive way, because we know that Nigeria is deeply traditional, deeply religious, and so we don't want to offend. Rather, we really want to have that buy-in, that partnership between the people, particularly the local people, because many of our patients actually reside in the rural communities. So we're looking at innovative ways of improving communication strategies, because I think that, like I said, is one way to really ramp up awareness. Then in terms of when patients come into the hospital, I mean, like you said, this is the 21st century. We are currently leveraging technology to be able to improve precision in terms of offering patients the best in terms of standards of care. One thing I failed to mention at the beginning is the fact that we also have a shortage of medical personnel across board. The physicians, the nurses, the therapists, the radiographers, there's a huge shortage of manpower. So we also need to think about innovative ways of bridging that gap. There are discussions that are going on around trying to promote competency-based learning to be able to bridge that gap while we ramp up training. And then obviously we are thinking about using technology as well to bridge that gap. There's also some apps that have been deployed across the country that help patients to understand some of the signs and symptoms that they're experiencing when on treatment, because we know that basically, I've always been a clinician until recently, and we know that some of the things that deter patients from finishing their treatment is the side effects of the drugs. And even as much as we try to educate them before we start, there's also that hand-holding that needs to happen while the patients are on that journey. And there are apps now that are currently available that have been deployed in the country to be able to bridge that gap. You know, patients are having problems, they need immediate answers to their problems, and this we are using technology to be able to bridge that gap, to give information and triage patients that need to come into the hospital to seek for that care as well. So leveraging on technology definitely is what 2025 will bring, partnering with patients to really hear from them, you know, the lived experiences, what we on the other side need to take more seriously to be able to address some of the challenges and problems that they might be facing, so that we can put out the best in terms of treatment and other services that we want to offer.
Okay, so now we've gone on this patient thing. Now I want to go to this patient. Yeah. I was dragging it slowly because, you know, okay, let's go to patient now. Patient advocacy or patient-led advocacy has been seen to be one of the most powerful tools to change the narrative.
True.
And for someone like me who came out, I remember coming out to start talking in public, and a lot of people were horrified. How can you say this? But I had a choice. I could either say it or leave it. And it's trying to get people to feel, if you say it, it doesn't become stigmatization. Unfortunately, like you say, cultural and religious values that we maintain in Nigeria stand against us in some ways, not in all ways. So how would you be able to involve cancer patients and survivors in co-creating solutions? And I want to look at, as you know, we did that pilot project we did earlier this year, end of last year. What were you able to bring out of that you think is something that could help us going forward?
Yeah, before I start that, I really want to publicly thank you for all that you are doing, how you are breaking the barriers, helping to destigmatize cancer in Nigeria. And as you refer back to the work that we did last year, being instrumental to pulling out the patients, getting the survivors to speak, to share their experience, and really helping us to provide deep insights from which we are working on to improve cancer care this year. I must say that myself and my team that worked with you and your team on that project, we're very grateful, you know, for letting us into your space. And it was very insightful, very informative. We've itemized about 7 different areas, 7 gaps that as clinicians, as policymakers, we really need to prioritize, you know, and these are informing some of the strategies and interventions we are trying to roll out later on this year. We all know that mental health issues, anxiety, fear was a strong recurring theme in the conversations that we had and the study that we did last year. Now, yes, we know, but taking it a step further, what really do we want to do about it? So that was very instrumental to helping us to think about what we need to do to be able to bridge that gap. It also showed us that we really need to be firm on quality and quality indicators. We don't now have a nationally acceptable quality indicator framework. And I think it came out again as a recurring decimal, because in listening to the stories, I went to hospital A and I did a bunch of tests and went up to scale, and they were scaled up to the tertiary hospitals or to other centers that had the facilities to be able to provide the treatment they needed, and they had to do everything again. What stops us from using what we had before to, you know, so these are things that we realize that at a national level, we need to think about really strengthening the quality, having quality frameworks, and to standardize what is out there so that physician A is confident to use the results or the reports from X center to be able to guide whatever treatment plans that he or she would like to put out for the patient. So, like I said, it was very rich, very informative. We're still trying to tease out a lot of the bits and pieces, but one thing again, and I refer back to that earlier comment that you said, was that we need to involve survivors if we hope to destigmatize cancer in Nigeria. And thank you again, once again, for working with us on that.
No, I'm not going to take that shine on that one. No. I'm going to say on behalf of all of us in all the geopolitical zones that participated, I am standing to say thank you, guys. I think hopefully we'll make a difference, and we'll build our network. Our group is going. We're going there. We've already launched our coalition. Okay. So with that in mind, I'm going to come back to research. And then I'm going to ask you to give me 3 things you want us to do for the next of going forward. This is a new year, a new beginning. But there's no point talking about if we don't recognize that research has to play a very important role. So, how can the Nigerian healthcare system encourage integration of research findings? And I'm very specific in this question in relation to the fact that one of the things that even came out in the study, and I know you would have observed it, was the fact that patients are not even able to trust the research process now, especially cancer patients. So how are we going to empower patients to come out of that space and feel, no? Because I do research and I'm engaged. I do research as in a patient and I engage in it. The question I always ask is, what has this going to benefit cancer patients or us that have the disease? So how are you guys going to change that narrative? Because honestly, that is not coming up as good.
Yeah, I think really being intentional about partnering with the patient groups, getting them involved at the initial phase to understand the process of research would help to strengthen their confidence and build their confidence in the process. Now, having said that, just to mention that at NICRAT, one of the things we are promoting really is trying to strengthen institutional research capacity across the country, and also trying to interact with the stakeholders and really getting them to understand that we need to come away from doing research for research's sake, but research that will ultimately inform policy and practice. The NICRAT has a 5-year research agenda. And with that agenda, it forms a roadmap for all those that are involved in cancer research in the country to be able to see what are the gaps, what needs to be filled. We cannot do it alone. We need to embrace a collaborative approach to do this. And in doing that, we begin to realize what the gaps are if we must change the cancer narrative in the country. Like you said, we have one of the worst indices, particularly for breast cancer mortality across the world. If we
Dr. Nwamaka, sorry to cut you. Our time is up. I've just found this conversation quite interesting, funnily enough. Time always stops at the wrong time, you know. But honestly, I think that we've been able to capture what is a good starting point. Let's put it like that. It's a starting point to a conversation for 2025. And that is what really matters. It's not so much. We can never capture everything in a space in one time, but we always try. Together we fight, together we win. Firstly, thank you for coming on and being part of this conversation and helping me to start 2025 on the right note, on all the key things. Follow us on our social media handles, Cormode Cancer Foundation. We're on Instagram, Facebook, Twitter. I think we're on Twitter, LinkedIn. You can find it. Just Google, you'll find it. Please, to all our viewers, those of you who want giveaway, Just go on those social media handles and be part of it. You cannot win if you're not in it. And that's a fact of life. And you must be in active treatment because it's to support people in active treatment. Your consultant will be required. So subscribe to our YouTube channel. This video will be out there. It will give you information. Dr. Nwamaka, thank you for coming up early this morning and listening to me rant all the last few days. Thank you. It's very nice to see you again. So our viewers, it's a new day. It's a new beginning. It's 2025. Let's walk it together. Together we fight, together we win. Let's all unite against cancer. Thank you all. See you soon. Our message is very clear. Together we'll fight. Together we win.